Welcome to another video in the series of Center for Justice and Law Spotlights. My name is Raina Meyer. I use she, her, hers pronouns, and I am a student in the Special Topics Health, Justice, and the Law course. And today I'm going to be chatting with Rachael Mills and Paul. We're co-hosting this conversation to learn more about reproductive justice and how that intertwines with her work. So I will hand it over to Paul to introduce himself as a co-facilitator as well.
Hi, I'm Paul. I use he, him, his pronouns. I also am I'm a classmate of Raina's. Rachael, would you like to introduce yourself, or should we just get right to the questions?
Yeah, I can introduce myself quickly and then we can go into questions. Does that work?
Yep.
All right. Hi, everyone. My name is Rachael Mills. I use she, her, and her pronouns. I'm excited to be here with Raina and Paul today to talk about reproductive justice and the law and the intersections of incarceration and, for me, public health and gender specifically. So I currently work at Metropolitan State University as the coordinator of health and wellness in their counseling center. And I graduated from the U of M with my public health degree, my MPH in maternal and child health.
Okay, thank you. So tell us about your work. How does this connect to our theme this year of health, justice, and the law?
For sure. So my background's a little bit convoluted, I guess, how I got to where I am. I started off in residential life and I did two master's degrees actually. So I did a degree in higher ed. And I realized through that I really wanted to look at health outcomes more than just working individually with students. But when I was in that program, I co-facilitated an Inside Out class at Shakopee Women's Prison. And it was specifically on storytelling and like empowerment through writing and telling stories, both our own personal narratives and reading narratives, right, of other folks. And so that an Inside Out class is where half the students were actually from Hamline. So I taught with Dr. Colleen Bell, and half the students were residents at Shakopee Women's Prison. And so it's a pretty cool program that is really transformative for all students, inside and outside students, and the facilitators. And that was my first real time teaching and learning at Shakopee Women's Prison. And that was what I focused my master's thesis on, was writing about how higher education and education in general can be so transformative when it is done intentionally and when it's grounded in critical theory and feminist theory, especially when you're thinking about a women's prison. And then from there, I went to do my master's in public health, and I worked with Dr. Rebecca Schleifer and some other graduate students, and we created a women's health course that we taught at Shakopee Women's Prison, specifically related to health needs, but from a gendered lens, right? So one of the things I think a lot about in my work around working with people who are incarcerated and justice-involved women and girls is that prisons were made for men. And then eventually prisons hosed women and non-binary folks and trans folks, but the same facilities and same rules and same policies were just put into those prisons. And so they are not created for women or for people who menstruate or for people who give birth. They were really created for men. And so thinking not only about prison abolition in general, but the gendered aspect of women's prisons and what that the impact that has on the people who are housed there. And so that's sort of my my background a little bit. I was teaching the women's health class until COVID. We actually were like about to go when the prison called and said, no more, like we can't have any more classes last March. And so we haven't been able to go back inside. But I did work with Rebecca Schleifer and some graduate students to create COVID-19 resource materials for folks who are incarcerated, because as you probably know, prisons are some of the highest levels of COVID outbreaks and deaths. And so we created a video with MDH that shows, like, for folks when they're being brought into prison to watch about COVID and the procedures in the prisons and to be educated around that, the outbreak. So, yeah.
That's really interesting. That sounds like incredibly important work. Yeah, and I'm kind of curious about like the impact that those courses had on the incarcerated people who learned from them. What did you notice about how their lives changed or how their perspectives changed after interacting with you and the other educators with this subject material?
For sure. I think that one of the things that I learned is that health literacy is really varied. And so there are folks on all levels, right? Not just in incarcerated populations, but thinking about topics around menopause. A lot of the women in prison are aging. It's an aging population, especially with the war on drugs and such long sentences, that folks are hitting menopause and don't have any education on that. And I think most women don't, and most people who menstruate don't really know like what to expect. But it's even more isolating when you're in prison and you don't have access to proper medical care and you don't have access to resources. And so one of the things that I really found was we had our materials, but the folks that were writing the curriculum, we weren't in prison, right? And so we didn't necessarily understand what the specific questions would be. And so we would have the material, but it would be a dialogue, and then folks would be able to ask us specific questions. And if we didn't know the answers, we would go back and find them and bring them the next week to class, because there's such limited access to like the internet or to any type of reliable medical resource in prisons, and that there was such a want and a need for that information. And it was a little difficult because we were all public health students. We weren't medical students or doctors necessarily. We had one medical student working with us, but a lot of the questions were very specific medical questions that people had that they couldn't get an answer to. And we, of course, couldn't provide medical advice. Like, that would be unethical, and we're not trained for that. But it was, it just shows what the need is. And then some of the stories that folks would say about like being taken off all their medicines cold turkey, even when they were, that's really dangerous, and not being able to get access to the doctors or to therapy or any of those things, which should be provided. It's just, I think it's, you know, those things, I think, from the research, right? But it's even more impactful when you hear it from people and you realize like, this is happening right in Shakopee. This isn't, and this is specifically happening in women's prisons. And there's such a need, because women and men, if we're being very binary in that, the statistics show that they go to prison for different reasons, and that women in prison have extraordinarily high rates of trauma, of histories of abuse, of sexual assault. Those are really high, and those needs are not being met at all in prison. And they're actually often being re-traumatized or exacerbated by the conditions of prison and the guards and segregation and all of that. And so I think that the trauma was really, really visible and aware, and having a space to talk about it was important, but it was also difficult because we were there for like a couple hours a week and then we left, and we couldn't do much about it, right? We were volunteers and we have no power. And so in some ways you would leave feeling really discouraged and helpless. So yeah.
Sure.
How can we support the work you do?
Yeah, I think that's a great question. So being a volunteer in the prison can be difficult because you have to go through pretty extensive background checks. You can't have any relationships with anyone who's been incarcerated. And so I think that just educating yourselves on prisons in Minnesota, and specifically the women's prison, the Shakopee prison, and volunteering if you can. Obviously with COVID, they're not doing any programming. But there are organizations like the Women's Prison Book Project. So you can volunteer with them and do letter writing or help organize books for women, and advocating that women's stories are uplifted too. And so not often when we hear about prison abolition in the criminal justice system, we're talking about men, and recognizing that everything's related, right? So I'm a public health professional, and one of the things we talk a lot about is social determinants of health. Have you heard of that before? Do you know what that means?
Yes.
Yeah.
That was a big part of our class.
Good. Okay, that's awesome. Yeah, so I guess I don't need to explain that to you at all, but seeing how interconnected it is, right? So it's not isolated. It's not just women in Shakopee right now, but it's families. It's a separation from their moms, right? And how that can be so traumatizing, and that can be an ACE and an adverse childhood experience. And so how can we look systematically at all of these issues? And you don't have to do direct service to create change. And so knowing what your skill sets are, what your passions are, and seeing how you can create change within that avenue, and how it's connected. So making sure you're educating yourself and understanding how it's connected to criminal justice and like police abolition and the prison abolition. And it has to be more than that too, because if we just take away things, and we have to also build better systems to be supportive of our communities.
Just quick question that popped into my head. You said that if you want to volunteer in the prison program, you can't have any relationship to someone who's been incarcerated. Is that like at all, or is that someone in the prison right this second, or is it just in the prison system right now?
It's you have to disclose any relationship you've had, like, and not even just personal relationship, family relationships, anything like that, ever, to anyone who's incarcerated in Minnesota when you're filling out your application. And I've been volunteering at the Shakopee Women's Prison for 4 years now. And so every year you have to reapply to volunteer. And a couple years ago, I disclosed all of the women I had worked with before, right? That I knew them, because you have to disclose if you know anyone. And they flagged me, and I was declined to volunteer because I had previously volunteered with women in the prison. And then it went up to the warden, and it was reviewed, and it was like I was able to petition it, and I was still able to volunteer. But there's some really, really strong barriers. And in my mind, I think some of that is to keep, I don't know exactly what it's for, but definitely the Brian Stevenson talks about the getting proximate, and that often we don't think about people we're not around, and we don't know. And so when you're proximate to people, you see their humanity, and you understand more of what they're experiencing, and therefore you can, it's harder to not care. And so I think some of that is to keep separate, to keep segregated, to keep people away, and especially folks that have relationships with anyone behind bars. And there are also awful rules about parole, where people who are paroled are not allowed to be in contact with anyone they knew while they were in prison. And so looking that up, so like, I think especially about women and in behind bars, like the community is so important. And Shakopee has a no touch policy. Have you heard of that at all?
I think we did, but I don't remember what it is.
Oh, it's I mean, it's exactly what it says, but it's been in place for many, many decades, and it's to prevent women from having any contact. Like you can't hug, you can't like hold hands, you can't high five, or you get put in segregation. And it's a homophobic rule. It was to prevent sexual relationships, I guess. I don't know. It's an older rule, but it's so unjust, because I think especially about women who are giving birth behind bars and then come back after 2 days, because they only get 2 days with their baby and are separated from their infant, come back, and they're not allowed to like hug their roommate or to be consoled by their friends. And there's a community. Women have community, but you can't have any physical touch. And so there's such deep touch deprivation. It's cruel and unusual, I would say. And there has been some traction around changing that recently, but it's things like that that people don't know about. And it's not, I don't know if it's even written anywhere. It's just sort of a known policy that's being employed. And then when folks come out, the friends and the connections and the support that they've made in prison, right? Whether that's through if they're in therapy groups or just in their roommates, or there's a housing unit for families and for moms, you're not allowed to have any contact because it'd be a parole violation. So then women will come out with absolutely no support. And if they were to reach out to people that they had been incarcerated with, that could be a violation that gets them put back in prison. So it is right, dehumanizing. It's absolutely dehumanizing and just really re-traumatizing and cruel.
It's disgusting.
Mm-hmm.
Okay.
Yeah, and sorry, go ahead.
Go ahead.
Oh, I was just gonna say, it's not the same for men's prisons. Like men's prisons, they don't have no touch policies. Like they can like play basketball and whatever and like slap hands and all of that. Like there's a lot more physical contact that's allowed in men's prisons. And so it's very, at least in my mind, it's really important to look through a gendered lens about how women are being punished differently and in cruelly, even compared to men. Not that men's prisons are okay either, but there is a different level and aspect within the gendered lens too.
Yeah, it's just hearing you say this, it all, like, none of these policies make sense. It's hard to think about how they're justified. But I'm interested, do you know of any legislative efforts that we could participate in ourselves that are challenging these rules or anything like that?
That's a great question. I am not aware of any currently, and I don't think that's because they're not there. I just am not fully aware. But one thing that has been done is, have you heard about the shackling laws and for women who are giving birth, people who are giving birth? Yeah. So that started in Minnesota, the advocacy to end those. And that was partly Dr. Schlafer was a part of that, and the Minnesota Prison Doula Project was a big part of that, of ending those laws. So that, because women were literally being belly shackled on their way while they were in labor up until 2010. Like this isn't like 40 years ago, this is now. And they were being shackled while they were giving birth sometimes. And so things like that, that advocacy was done to change that law, and it worked in Minnesota. And that's also being done in like places like Alabama has the doula project now too. And so I think looking for laws like that and recognizing that it does work, the advocacy does change things, and it is important. There was also, tampons weren't allowed in prisons until recently, until like 2 years ago. I think Shakopee got tampons. Before that, they were only given really large maxi pads that women would actually create tampons out of, which is super dangerous in terms of like toxic shock and your health. And so things that are literal basic needs, basic human needs. I think looking for laws around that, I'll do a little searching in my networks afterwards to see what's on the docket. But yeah, it's interesting. And I think that drawing attention to it, people are outraged, and rightfully so. And so some of it is just letting people know and telling people like, this is what's happening literally in our backyard to women and to people that live and are community members of Minnesota. And like, that's not okay.
Forgot I was muted. This semester, we have structured our class around the sub-theme of reproductive justice and incarceration. So what does reproductive justice mean to you? How does it relate to the work you do? What is some of the research or experience you've had as it relates to this topic?
That's a great question. So my major, I guess you can say, in public health school was maternal and child health. And something that I think a lot about is the importance of doulas and how it's reproductive justice, of course, plays a role in prisons. But I think it's broader than that too. And so thinking about the maternal mortality rates based on race and how there is racism within our systems, our health systems, our insurance systems, that impacts birth outcomes, specifically for Black women and Latinx women, and how that's an aspect of like criminal justice reform, is having better systems and health outcomes for Black women, and doing trainings around racism, and having doulas who can advocate for women when they're giving birth, and for people when they're giving birth, birthing people. And just it's so much bigger than, it's all connected, right? And then also thinking about like the killing of Black men and Black women's sons, and how that is a reproductive justice issue, and it's families, and it's just all interconnected, and thinking more broadly than just the actual like prepartum, postpartum, and the birth, that reproductive justice is larger than that. And it's very based on race. It's also based on gender, and thinking about our trans community members who are giving birth, and how that is so stigmatized still and misunderstood, and how like medical schools aren't necessarily teaching how to support people who are non-binary or trans, and birthing. And so yeah, I think it all connects, and it's all important in one, like some advocacy around one thing also can help others too. So yeah.
Yeah, absolutely. Thanks so much for sharing your insight on that. The work you do is incredibly important. And then I guess to kind of close out on the conversation, our last question is, do you have a call to action for us or other people who might be listening in, things that we can do to help?
I love that question. I would say one thing is just pay attention to the media that you're taking in, and especially around justice, and who you're listening to, and making sure that voices that are not just cis male are being uplifted too within prison abolition. And thinking like Brian Stevenson's book, Just Mercy, is awesome and amazing. And there's only one chapter, chapter 12, that has anything to do with women in prison, and how even like a lot of the research and media and advocacy work is focused specifically on men's prisons, or just on prison in general, which equates to men's prisons. And so just making sure that you're seeking out intentionally voices that provide a nuanced narrative to that, and include women, and recognizing that the resources women need in prison are different than in men's prisons, and also looking for resources around trans people in prison, and about how often like trans people are put in segregation for their safety, because prisons are not equipped to support any type of gender transition, or placing people in housing that affirms their gender identity. And so just thinking within the intersections of identity and prison, making sure your media has diverse voices represented. That would be my call.
Well, thank you, Rachel. And thank you, everyone who has watched this. I've been Paul Tripeny. My partner over wherever on the screen is Raina Meyer. And this has been our Center for Justice and Law Spotlight.
Thank you so much for having me. It was great to chat with you both.
Thanks so much, Rachel.